Understanding infectious diseases is crucial for protecting ourselves and our communities. Infectious diseases are a constant threat to human health. They are caused by microscopic organisms that invade our bodies and multiply. These invaders, known as pathogens, disrupt our normal bodily functions, leading to illness. By learning about the causes, symptoms, treatments, and prevention methods, we can make informed decisions to stay healthy. Infectious diseases have plagued humanity for centuries. From the Black Death in the 14th century to the COVID-19 pandemic in recent times, these diseases have shaped history and continue to pose significant challenges. However, advancements in medicine and public health have given us powerful tools to combat these threats. The study of infectious diseases is a complex and ever-evolving field. New pathogens emerge, existing ones mutate, and our understanding of these diseases continues to grow. This constant evolution underscores the importance of staying informed about the latest developments in infectious disease control and prevention. By understanding the principles of infection control, we can all contribute to a healthier future for ourselves and generations to come. Knowledge is power, and in the realm of infectious diseases, it can be the difference between illness and well-being. Like, share, and subscribe to the Diseases and Cure channel for more insights and updates on infectious diseases. The world of infectious diseases is populated by a diverse cast of microscopic characters. These pathogens, though invisible to the naked eye, are responsible for a wide range of illnesses, from the common cold to life-threatening conditions. Bacteria are single-celled organisms found everywhere on Earth, from the soil to our own bodies. While many bacteria are beneficial, some can cause infections. These harmful bacteria produce toxins that damage our cells and tissues, leading to symptoms like fever, inflammation, and pain. Viruses are even smaller than bacteria and cannot reproduce on their own. They invade our cells and hijack their machinery to create copies of themselves. This process disrupts normal cell function and can lead to cell death. Viral infections can cause a wide range of symptoms, from mild respiratory illnesses to serious neurological conditions. Fungi are a diverse group of organisms that include yeasts, molds, and mushrooms. While most fungi are harmless, some can cause infections, especially in people with weakened immune systems. Fungal infections can affect various parts of the body, including the skin, lungs, and brain. Parasites are organisms that live in or on another organism, the host, and benefit by deriving nutrients at the host's expense. Parasitic infections can range from mild to severe and can affect various organ systems. Examples of parasites include protozoa, worms, and insects. Understanding the different types of pathogens is crucial for diagnosing and treating infectious diseases. Each type of pathogen has unique characteristics and requires specific treatment approaches. By identifying the culprit behind an infection, healthcare providers can determine the most effective course of action to combat the illness. When pathogens invade our bodies, they trigger a cascade of events as our immune system mounts a defense. This battle between our bodies and the invading microbes often manifests as a range of symptoms, signaling that something is amiss. General symptoms of infection are nonspecific and can indicate a variety of illnesses. These symptoms are the body's way of alerting us that something is wrong and prompting us to seek medical attention. Common general symptoms include fever, fatigue, muscle aches, headache, loss of appetite, and swollen lymph nodes. In addition to general symptoms, infections can also cause specific symptoms that provide clues about the type of pathogen involved and the location of the infection. For example, respiratory infections often cause cough, sore throat, runny nose, and difficulty breathing. Skin infections can lead to redness, swelling, pain, and pus-filled sores. Gastrointestinal infections typically cause nausea, vomiting, diarrhea, and abdominal cramps. Urinary tract infections can lead to pain or burning during urination, frequent urination, and cloudy or bloody urine. It's important to remember that not everyone experiences the same symptoms, and the severity of symptoms can vary widely. Additionally, some people may be infected with a pathogen but show no symptoms at all, making them carriers who can unknowingly spread the infection to others. Recognizing the signs and symptoms of infection is crucial for seeking timely medical attention and preventing the spread of disease. If you experience any unusual or persistent symptoms, especially those accompanied by fever, It's essential to consult a healthcare professional for proper diagnosis and treatment. Section 4. Fighting back. Treatment strategies for infectious diseases. Once an infection is diagnosed, the battle against the invading pathogens begins. The choice of treatment depends on the type of pathogen involved, the severity of the infection, and the overall health of the individual. Here's a closer look at the treatment options for different types of infections. Bacterial infections, targeting with antibiotics. Antibiotics are powerful drugs that specifically target and kill bacteria. They work by interfering with essential bacterial processes, such as cell wall synthesis or protein production. Antibiotics are effective against a wide range of bacterial infections, but it's essential to use them appropriately to prevent antibiotic resistance. Viral infections, supportive care and antivirals. Unlike bacteria, viruses are not susceptible to antibiotics. Treatment for viral infections often focuses on relieving symptoms and supporting the body's natural defenses. Rest, fluids, and over-the-counter medications can help manage symptoms like fever, aches, and congestion. In some cases, antiviral drugs may be prescribed to target specific viruses and shorten the duration of the illness. Fungal infections, antifungal medications. Antifungal medications are used to treat fungal infections. These medications work by interfering with fungal cell wall synthesis or other essential fungal processes. The choice of antifungal medication depends on the type of fungus causing the infection and the site of infection. Parasitic infections, antiparasitic drugs. Antiparasitic drugs are used to treat parasitic infections. These drugs work by targeting specific parasites and interfering with their life cycles or metabolic processes. The choice of antiparasitic medication depends on the type of parasite causing the infection. It's crucial to follow a healthcare professional's guidance for treating infectious diseases. Self-treating can be dangerous and may lead to complications or the development of drug resistance. By working closely with a healthcare provider, individuals can receive the most appropriate and effective treatment for their specific infection. Section 5. The power of prevention. Safeguarding our health. While treatments for infectious diseases have advanced significantly, preventing infections in the first place is always the best approach. By adopting healthy habits and taking proactive measures, we can significantly reduce our risk of contracting and spreading infectious diseases. Here are some key prevention strategies. Vaccines, our best shot at disease control. Vaccines are one of the most effective public health interventions ever developed. They work by introducing a weakened or inactive form of a pathogen into the body, triggering an immune response without causing the actual disease. This immune response primes the body to fight off the pathogen if it encounters it in the future. Vaccines have dramatically reduced the incidence of many infectious diseases, including measles, mumps, rubella, polio, and tetanus. Hygiene, a simple yet powerful weapon against infection. Practicing good hygiene is crucial for preventing the spread of infectious diseases. Simple measures, such as washing hands frequently with soap and water, covering coughs and sneezes, and avoiding close contact with sick individuals, can significantly reduce the transmission of pathogens. Food safety, protecting ourselves from farm to fork. Foodborne illnesses are a significant public health concern. We can reduce our risk of contracting these illnesses by practicing safe food handling procedures. These practices include washing fruits and vegetables thoroughly before eating, cooking meat to the proper temperature, storing food properly, and avoiding cross-contamination between raw and cooked foods. Safe practices, navigating intimacy and injury risks. Certain activities, such as unprotected sex and sharing needles, can increase the risk of contracting blood-borne infections like HIV and hepatitis. Practicing safe sex by using condoms and avoiding needle sharing are crucial for preventing these infections. Vector control, reducing exposure to disease carriers. Many infectious diseases are spread through vectors such as mosquitoes, ticks, and fleas. These vectors can carry pathogens that cause diseases like malaria, Lyme disease, and plague. Reducing exposure to vectors through measures like using insect repellent, wearing protective clothing, and eliminating breeding grounds around homes can help prevent these diseases. Prevention is a shared responsibility. By adopting these preventive measures, we not only protect ourselves, but also contribute to the health and well-being of our communities.